If you take health insurance as payment, payors are a big part of your practice. What happens when they mess up? How do you hold them accountable? Can you hold them accountable? The answer is yes. That's what my guest at least says today. He runs a business that spends a lot of time holding payors accountable for their clients, and he's going to help us kind of get to know this and break it down a bit for us. I'm Carl White, principal at Mark Advisory Group, which is a healthcare marketing agency, and I'm also the host of Practice Care. The mission for both is the same, and that's to help private practice owners stay private. It's usually what they want, but care is better when it's the providers of care who own the practice, because then every decision that matters, whether it's clinical, business, or otherwise, is made by those who are delivering care. And that way we can be most assured that patient care and what patients' needs are always being considered and are always at the top of the list. My guest today is David Zetter. David is the founder and president of Zetter HealthCare in Mechanicsburg, Pennsylvania. He's got over 24 years of operational and healthcare experience. David is nationally recognized for his speaking engagements and his healthcare business expertise. He's well-versed in regulatory requirements, revenue cycle management, credentialing and contracting, compliance, and coding and documentation. He's considered an expert on Medicare, not only by his clients, but also through consultant colleagues and healthcare attorneys across the country. He's also an expert on ERISA regulations, which is, if you're not familiar with ERISA, shockingly prevalent in our daily lives, which protect over 80% of claims in the US, and he knows how to stop payer recoupments dead in their tracks and what is legal and illegal in many payer contracts. David's firm works with healthcare professional clients and facilities coast to coast in all areas of practice and facility management. I've known David for a few years now. This is far too long in coming, but thanks for coming on Practice Care.
Thanks for having me, Carl.
Yeah, so I always start in the same place. That was kind of a, sort of a brief bio about you. Tell us a bit more about yourself, you, the firm, wherever you'd like to kind of fill in gaps.
Sure. So, I've been doing this for over 25 years now. Prior to that, I ran many, many restaurants coast to coast. So I knew business. I just didn't know healthcare. Ended up going to work for my wife's boss that ran an accounting and consulting firm. And basically, I took the consulting side of things and we literally blew it up. So now, many years later, we've got clients in all 56 U.S. territories, and I'm seen as a thought leader, believe it or not. Shocks me too. So, but no, I love what I do. When our clients smile, it makes me happy, and that's what drives me on a daily basis.
Excellent. Yeah, we are both. Oh, go ahead. Keep going.
No, so I mean that's what we do. I've got basically we've got 16 people that work in Zetter HealthCare. 9 of them sit here in Pennsylvania. The rest are around the country, and we do everything we can to protect and to provide strategic thinking and viability to our clients all around the country.
Yep. Yep. And I've heard David speak, and it's all true. He is, I just think of like a walking encyclopedia of all things related to getting paid properly, getting paid on time, starting up properly, all sorts of things related to the, the business and the practice of healthcare. And we're taking a big topic here. We're going to try to break it down, holding payers accountable. So there's something going on right now as we record this, down coding. It is, if you're a victim of it, you know what it is. If you don't know what it is, you're about to be shocked, because I want to ask David just to tell us a bit about what's going on, because it directly relates to our topic.
Yes, sir. So this past week or two, Cigna, in their infinite wisdom, they're doing it again, just like they did last year, trying to deny services with a 25 modifier tied to it. That was stopped pretty quickly. Now they've basically published a policy on their website where they are going to downcode all E&M services if they're above a certain level, whether they request records or not. They're going to downcode it. Well, that is flat out illegal. They can't do this. They're going to try and get away with it, and they will, for all of you listening that don't know the laws and don't hold them accountable. Payors do this daily, and prior to us recording this, I even told Carl, payors lie, cheat, and steal every day. That's just what they do. Their job is to keep their money in their bank account. Mm-hmm. Our job is to get the money, but we're forced to do it legally. Payors will do things illegally because they know no one out there knows what the laws are, so they get away with it. So how are we going to hold them accountable? Well, the first thing, I made a post on LinkedIn this week. We've got 120,000 people that have already seen it. We're trying to create a national uproar so that Cigna ceases and desists this policy. In addition, we can report them to the OIG and everything and other, the state insurance commissioners and so on. So there are ways to hold payers accountable, including writing letters to the proper people at the payer, because the claims department isn't going to do anything for you.
Mm-hmm.
So that's one issue that's popped up. And Cigna's not the only one doing it. It's just that they've published a policy. Anthem has been doing it, Anthem Blue Cross Blue Shield, or Elevance Health, as they're called now. United HealthCare, Humana's done it. There are many payers that have done this, are doing it, and are going to continue doing it.
Yep.
But the question is, how do you stop them from doing it?
Yep.
And that's the big question.
So just define what downcoding is for those who may not be familiar with it.
Sure. So you go to a doctor,
yeah,
and you're either going to have a new patient office visit or an established patient office visit.
Mm-hmm.
Nowadays, there are 4 new patient office visits, 4 levels. And it's all determined based on the level of service that was provided by the practice and the providers during your encounter on that date of service.
Mm-hmm.
So if it rises to the level of a level 4 visit, then there are certain things that need to be documented in the medical record. And normally a payer would downcode based on the fact that the documentation in the record does not support the level of code that was submitted. And us coders, certified coders, know what kind of documentation that is. When they do your review of systems, your exam, medical decision making, and all of that, there are different levels of all of these types of services that rise up and reach a total level of service for that date of service or
Mm-hmm.
encounter. So if you submit a level 4 in a billed claim to Cigna, chances are they're just going to automatically downcode it to a level 3, and they're not going to bother asking for records. They're just going to downcode it. You can't do that. You're not supposed to do that. The only way they can prove and justify the downcoding is if they can prove the documentation does not support the level of code that was billed.
Right.
And that's the only proper way to do it.
Mm-hmm.
So they're trying to cut out one step where they're submitting requests for records, and then they have somebody review them, and then they provide you feedback on whether you made good on your documentation or not. And that's basically downcoding.
And so there's all sorts of money that should be paid to providers that is not, because they're just auto downcoding these.
In this situation, yes, that's what will occur.
Yeah.
Absolutely.
Okay. Yeah. So, and is this an area where you could hold, like Cigna's this large behemoth, it's a building really, so to speak. How do you hold them accountable? What's that? Many buildings. It's a campus. That's right. That's right. It's very impersonal. That's my point. You made the point before we started talking that the last place to go for any sort of, any sort of fixing of this is the claims department, because they're trained otherwise. Correct. So how do you hold the large multi-building all across the country behemoth accountable for something like this?
Well, in some cases, if there's something that we find out in an article or we've got a concern about something, normally I will contact somebody at the payer, because in my business, we've collected contact information for payers for 30 years, nearly 30 years. I've got a 56 cab Excel workbook that has every state and every U.S. territory on it. And in that workbook, I've got email addresses, phone numbers, names of CEOs, all the way down to the lowly credentialing specialist in every state for every payer.
I hope you've got that thing backed up.
Yeah. Oh, yeah. Yeah. Every 15 minutes, I back it up.
Good.
But no, we use that every day because we credential over 10,000 providers a year. Mm-hmm. So we use it an awful lot. But normally I'll pick up a phone and either talk to a contracting manager, a credentialing manager, or if we really have an issue with like recoupments and violations like this, then I'm going to contact the compliance department, their attorneys, and their CEO, because those are the only people that know what the laws and the rules are and they know when they're speaking to somebody that knows what the laws and the rules are,
Mm-hmm.
and they don't want to get busted.
Mm-hmm.
Although I wouldn't say that much about United Healthcare, because
Well,
they've paid millions and millions of dollars in claims, and that's just a drop in the bucket to them.
mm-hmm.
So yeah, you've got to find the right people to talk to, those that are going to actually do something about it. And then you need to contact them, provide them all the details and facts. And when you know what the laws are, you can quote citations of the Federal Register as well as regulations to make them aware, yes, you know what you're talking about, and then they take you seriously and they stop it. So like I was telling you earlier, had a client that basically was getting recouped $167,000 by United Healthcare, wrote a letter to the CEO, copied the compliance department, sent a copy to the patient and their fiduciary of their health plan, which was their employer. Then we also copied the EBSA, which is the federal agency that basically provides oversight to the ERISA regulation, which,
Mm-hmm.
by the way, is a Department of Labor law, not a healthcare law. That's why most people aren't aware of it.
Yeah.
But it's fully published on the Department of Labor website. So when you send a letter to the CEO and let them know, look, you're collecting money on claims that are current for claims that you claim shouldn't have been reimbursed from a year ago. Well, that's illegal under ERISA. So what happens? They get the letter. 48 hours later, I get a phone call and they cease and desist from that recoupment because they know we're right.
Yeah.
And they know we'll report them to the OIG and anybody else that we need to in order to stop them. It works.
Mm-hmm.
It works almost every time. The only time it doesn't is when I send the second letter, and then it definitely works. They just didn't read the first letter.
Right. And so the 167,000, I just want to like say it differently, see if I've got this accurately. In essence, what they're saying is, hey, previously we overpaid you $167,000 over a variety of patients. So we're just going to start taking that back now.
Yeah,
And that's
as we pay you for the
as
current.
we pay for the current, even though we overpaid you on, this pool of patients over here, the different pool of patients you're seeing now, that's where we're going to recoup that from.
Correct.
And that's
And
totally illegal.
Yeah, what you need to understand is that ERISA and everything else, the patient owns the claim,
Mm-hmm.
the patient owns the records. No one else does. No physician in this country owns the claim or the records. The patient always owns it. So you want to bring the patient involved and the owner or the fiduciary on that health plan, which ERISA is only protects claims that are sponsored by an employer that is not a government entity of any type or a religious organization of any type.
Mm-hmm.
So township, city, state, whatever, that's government employees. Same thing with Parks and Rec, police department, anybody that gets a paycheck from a municipality of any type,
teachers,
that is not an ERISA sponsored claim.
Okay.
Then you've got religious organizations, parochial schools, churches. They would not be an ERISA sponsored health plan. Okay, but everything else is.
Mm-hmm.
Obamacare, the state websites that are selling health insurance, all of those are covered under PPACA, which dovetails into ERISA. So even those the exchange plans are covered under ERISA.
Mm-hmm.
So there's a lot of claims, 83% to be concise,
Mm-hmm.
because the Federal Department of Labor website says 17% of our population is employed by a government agency or a religious organization.
Mm-hmm.
So that means more than 80% of the claims are covered under ERISA laws. And there's a lot of things that ERISA protects against.
Yeah.
Including recoupments and including many other things like prior auth. Payors cannot just dictate which services get prior auth. The patient's policy dictates that.
Mm-hmm.
And that is negotiated by their employer.
Mm-hmm.
So you can't say that, okay, this PPO plan is the same for everybody, because some employers negotiate what's in the plan. So you have to have the most important document in healthcare is the patient's healthcare policy. How many practices have them? 0. No one has ever requested a copy of their policy from the patient. The second best document in healthcare is the summary plan description, which is required to be communicated to any employee by any employer or any health benefit plan, whether that's life, disability, health, vision, dental insurance, retirement plans, any benefit sponsored by an employer that is covered under ERISA is an ERISA sponsored health plan or insurance plan. And that's what's covered by ERISA.
So as I start to break the sort of boil this down, holding payers accountable, one takeaway is know the laws, which is not, it's easy to say, it's not easy to keep up with.
Oh, that is correct.
You know, just documenting them and cataloging them and staying current with them, and then knowing what they do and don't say.
Correct.
Yeah.
And there's even more than that. ERISA is probably the biggest law out there, but I'll bet most of your listeners don't know that there is a place where every managed care law and regulation for every state is published. That is what is gold in a contracting and credentialing environment. Or participation with any insurance, because the states actually dictate what the managed care payers and providers can do, and the state dictates whether it's lawful or not. And we use those laws all the time to shut payers down in their evil processes that they're trying to communicate.
Yeah, it's amazing. I mean, yeah, it's sort of break the law's growth strategy. So you go back to tie it together, take this $167,000 and assume it never gets looked at. The payer is saying, well, we'll either keep all of it or most of it because we'll go to court, we'll lose, we'll settle, and we'll pay something. But it's not going to be, probably not going to be everything that we collected, you know, illegally. It's depressing, David, I got to tell you.
Well, here's another example. So I've got a client out in California that we're dealing with right now. They haven't been paid probably, if I recall, it was in excess of a couple $100,000 in claims.
Okay.
This is Anthem, okay, Elevance Health, that isn't paying for their services. But they paid the surgeon and they paid the facility where the procedure was done. They just didn't pay the anesthesiologist. So we did a bunch of research.
On what basis?
There is no base. They have no base.
I'm like, you can't have a surgery without an anesthesiologist. They had to have done what they're supposed to do.
Well, exactly. They did what they were supposed to do, and they paid the surgeon and they paid the facility, but they're claiming they don't have to pay the anesthesiologist. Well, that's a bunch of hogwash.
Right.
So we did all our research, communicated it back to the client, and developed a form letter for them to send to every patient and every patient's employer, making them aware that their insurance is not paying the claim. Okay. Yes, the patient may have gotten an EOB that said it was denied, but sometimes most patients don't pay attention to that and they don't think they're going to be responsible. Well, guess what? If the payer's not paying it, the patient needs to pay it. And the practice is going to go back after the patient. So what we're going to do is we're going to involve that patient and the employer and make them aware that their insurance company that they contracted with is not paying for services. We're going to hold the patient accountable unless they get involved and help us hold the payer accountable. And the employer is the fiduciary of the plan. They're required to enforce the laws, state and federal, on any health plan. Otherwise, they can be fined an amount every day they don't enforce it.
Wow.
So the employer can get into big trouble. And they could have their plan denied. It could possibly cause the state insurance commissioner to deactivate the plan in the state it's being sold. And it could be fraudulent because they're advertising that they're going to pay claims and now they aren't. So there's all kinds of stuff that can happen from this. And I guarantee you, when the payer finds out that these letters are going out to patients, how much you want to bet my client's going to get paid?
Yeah. Yeah. And is there, well, I was going to say, is there any sort of interest or anything for delay? There isn't, right? It's.
Oh, absolutely. There are laws.
Oh, there is?
Oh, yes.
Okay. Glad I asked.
Yes, you can collect interest on non-payment and so on.
Okay.
Every state has many managed care regulations, and we dive into it, and those letters literally put the citation from the regulation. We communicate it to the insurance commissioner. We're going to communicate to whoever we need to make sure that the payer holds up their part of the bargain and based on what their contract says.
Yeah. Yeah. I mean, this is kind of like it's an uplifting discussion because it says you can fight back. So part of it is part of it is knowing the law, and the other part is strategy. So in this $200,000 story, it's turn up the heat on everybody else who's involved.
And quite frankly, once you start doing this, you get your form letters done, and then all you got to do is change some information. Like if you have to submit a letter to, Cigna about recoupments, well, now you've got your recoupment letter, you've got citations of the laws and everything. Now you just have to change who you're addressing it to and which payer you're sending it to.
Yeah.
And now you've got a documented, drafted letter that you can use for any patient in these types of situations. But there are probably 15 to 20 different types of letters that can be mailed out, whether it's for recoupment, whether, there's another law for how many of your listeners are getting massive quantities of medical record requests from payers, including from Medicare Advantage plans for the risk adjustments that they're doing. All they're doing is looking for more diagnosis codes out of the medical records that may be in a record. So you'll get a request that'll entail all encounters from January 1 of 2024 through today of 2025. They're looking for all those records because they want to pull as many diagnosis codes as they can because the payer gets paid more by Medicare for the more complicated patients that you're treating. Okay? So even though you didn't do anything for that diagnosis, if there's a diagnosis from 9 months ago that you may have documented in their record, the payer is going to add that even though it doesn't justify it for the current encounter. And they'll get paid more. It's illegal, and the OIG is starting to take notice of this.
Why is it illegal?
Medicare Advantage is the biggest scam perpetrated by Congress ever in the history of the U.S.
Let's come back to that. Why is that illegal? If they're looking for a code that's already there, why is it illegal?
From the standpoint on the services that you're billing and everything, the payer's got to pay on those services, okay? But from the standpoint on the code that's being submitted, it all depends on what is in the contract, what the payment is, and so on. But when you're talking about medical records, that's when there are certain amount of records that they can request based on the size of the practice, and they can only request them every 45 days. So you have to know the law. You have to know what to communicate to the payer. So like your listeners that are sending records to places like Ciox, Datafide, Datavant, Vertex, all these third-party vendors, you're violating HIPAA because none of those third-party vendors are BAAs with you or the patient, okay? You cannot send records to somebody that has no knowledge about that patient. You can send them to the insurance company. So what we do is I contact like Datafide on the number that's on the request letter for those records, and I make them aware, one, you're requesting way too many records. Here's the law, and this is how many records you can request. Number two, we're not sending records to you. We'll send them to the payer, but we're not sending them to you. Secondarily, when you do send records and the payer says, oh, it didn't show up, guess what? Now there's a HIPAA violation because they've lost your records.
Right.
Okay? How much you want to bet they find those records?
Yeah.
They're just telling you that because they want you to keep jumping through hoops so they don't have to pay the claims. Jeez. Remember, they don't want to pay claims.
Yeah.
It's a game, folks. We're just playing games and jumping through hoops. And as long as you understand U.S. healthcare is a game, then you won't pull your hair out. And as long as you know the laws and you have drafted documents, it's very easy to do this because you said it's going to take knowledge of the laws and it's going to take communications and know who to communicate with. You also need the time to manage this
Yeah.
because it is becoming inundated.
Yeah.
The amount of recoupments, the amount of medical record requests, the amount of denied claims, it is growing and growing on a daily basis.
It's crazy. It's just crazy. It's, well, I'm
It's hard to
depressed.
make money in healthcare
I'm depressed again, you know?
unless you have your facts straight.
Yeah. And you have to know what they are, how they apply, when they don't apply, who
Yep,
to tell them to, who to keep who to turn the fire up on, et cetera, et cetera.
exactly.
Um,
Exactly.
so we've already covered a lot of ground. In the context of that, is there anything you think we should have hit on, but we didn't? Anything else that comes to mind?
Well, I mean, what I would advise your listeners to do is, if you don't have the time to educate yourself, because there are many laws. I mean, I'm a certified compliance officer and compliance consultant.
Hmm.
My job is to stay up on top of this, and I can't.
Hmm.
I mean, I've got too many listservs that communicate new laws, regulations, compliance organizations, things like that. You've got to read up on this stuff daily. Just that alone causes me to get well over 1,500 emails a day. How do you clean that out and do work at the same time?
Hmm.
So it's hard to stay up on all this. So my suggestion is whether you utilize Zetter HealthCare or somebody else, just surround yourself with experts that know what they're doing, that can help protect you. And you've got to vet your experts as well, because just because somebody says they're an expert, they need to prove it.
Hmm.
And how does somebody prove it? Well, they talk about it and they provide you quotes and citations. And what I tell people, look, if I provide you information, if it's a law or regulation, I'm going to provide citations. That way you don't think it's just David Zetter spouting off at the mouth.
Hmm.
If it's my opinion, I'll say so. If it's my experience, I'm going to tell you, and I'm going to provide examples of what exactly happened.
Hmm.
That way you can help educate yourself, learn from it, and you can decide whether you want to follow that advice or not.
Yeah. Yeah. And the other sort of wrap up question I ask is, how can somebody get started on this? But I want to massage it too. Like, how do they work with you? So you're the ongoing consultant. They like, how would you plug into a practice to do this? Is it just sort of as issues arise, or what,
Yeah, normally we don't call potential clients or anything like that. We're too busy to do that. So we get inquiries every week. I get phone calls, 5 to 10 every single week, somebody wanting to request services of us. If it's, handling a recoupment, things of that nature. Normally we'll help any client that is an existing client of ours with anything they need. We're a full service practice management consulting firm. So I tell my clients, if you've got any question about the business of healthcare, you call us. We guarantee we're going to give you the right answer. We're going to provide you citations, and you'll know exactly what needs to be done to resolve it. Client just needs to engage us for our services.
Okay.
Once we get an engagement letter back, we'll help them with anything they need help on in their practice.
Okay.
We'll bulletproof it if that's what they want. And there are ways to bulletproof your practice so that a payer cannot take advantage of it. But it's a lot of work. It's setting up policies, procedures, and systems properly, and training and educating your staff. You need to spend money on continuing ed because your staff is what protects you. Even working with us, we still work through the staff. We educate them because we don't want to spend all the client's money in having us do everything. If we can train the staff to do it, it's going to save them money and they're going to be much happier that way.
Yep. Yep. And then you've got some on the ground
Then we
experience
got
as well.
a client for life.
Yeah, exactly. Exactly. Yeah. That was the, how does, because, in this, what we're talking about here is if there's no payer issues, there's nothing to do. So
There are always payer issues.
That's right.
Even if you think there aren't.
Well, in a particular, I know. I sound really naive in this. It's,
I know you're not.
I think my natural brain just, well, it's just, it's the limits of my own imagination. I need to hear you give more stories about how deceptive and how it's just it's freaking depressing is what
Oh,
I'm
I
still
know. The
depressed.
war stories we tell each other when we get together at our consulting conferences. I
Yeah.
mean, yeah, sometimes we all wonder, what the heck did we get into this business for?
I mean,
To help people. That's exactly
I
what.
know. I'm small fry. Every once in a while, a client says, I got a 1-star review and we don't know who that is, not a patient. That's like my biggest head. Like you blow that out of the water. Like I have simpler times, it seems.
Well, we do different types of work. That's all.
I know, but
It's all important.
holy cow. I just don't get as depressed by what I do as you may sometimes. I don't know. It's anyway.
It does get. It's definitely frustrating. I wouldn't say I get depressed because I see all of these as opportunities. I
Yeah.
see the opportunity to make my client more money.
Hmm.
I see an opportunity to make them smile, and I see a bigger opportunity when they brag about us to all their colleagues.
Yeah. And you get to stick it to the health insurance players.
Oh my God, that is the most rewarding
Don't you wish you could like
reason ever.
be a fly on the wall in the CEO's office when they're reading one of your letters going, are you kidding? We did what? You know.
Well, I'll give you a real quick example. So I
Okay.
posted that post to LinkedIn,
Hmm.
and I basically put at Cigna Healthcare to make sure they saw it.
Hmm.
Their social media team just responded and say, "Oh, we'd love to help you. Please contact us." Wait a minute. I've already put out there what the issue is, and now you want me to contact you? No, your CEO needs to call me.
Yeah.
And
Yeah.
that's what's going to happen.
That should be your response. Tell your CEO to call.
Yeah, I know. But your listeners can go out, look me up on LinkedIn. You'll see the post.
Yeah.
It is horrendous. It is getting a lot of play, and there are a lot of people commenting on it. And I hope to God this shuts them down very soon.
Yeah. Yeah. And your contact info is going to be in the show notes for this episode, including your LinkedIn.
Oh, well, thank you very
I
much.
definitely found that. Yep. Thank you so much for coming on. Preview listeners, David's going to kind of come on a couple more times, talk about different aspects of the business side of healthcare. Today was holding payers accountable. We thought we'd start with a simple, small topic. So just wait for next time. Like I said, this contact info is in the show notes for this episode. So that's yet another way to get a hold of them. A couple of points before we wrap up. First, please subscribe to Practice Care if you haven't done so already. Practice Care is one word, easily searchable. We're everywhere. New episode every week. That's the easiest way to stay up to date. And secondly, if you're like David or us, you serve private practice owners or you serve healthcare providers, or you're one yourself. Either way, you've got some experience on the business side of private practice. Don't overthink it. All experience is useful experience. We want you to come on Practice Care and share it with our listeners. In the episode, in the show notes for every episode, there's a link, a couple of clicks, take you a minute, tell us what's on your mind, and we'll get you scheduled as soon as possible. Thanks very much, and until next time.